So new technology is going to surprise us in the way it's used in healthcare. How will this present itself? Will it be through smartphone devices? Will it be through holograms? Will it be through, I don't know.
I have my fingers crossed for holograms. I'm Dr. Louise Massara, and this is the Future Health Podcast. Today we're speaking to Professor Michael Kidd AO, the inaugural director of the International Centre for Future Health Systems at the University of New South Wales. And by the time this podcast airs, he will have taken up the post as Australia's Chief Medical Officer. Michael has a vision for a more equitable health system, driven by reforms in the primary care and hospital sectors, enabled by technology and innovation. He is leading a multidisciplinary research team to deliver these insights and provide the advocacy that will help us realise that future. Michael's an academic and educator, holding joint appointments with the University of New South Wales and the University of Oxford. In addition to his academic roles, he's worked for over 35 years as a general practitioner in urban and rural practices across Australia, Canada, and South Africa, with special interests in the care of people with HIV, mental health, and Indigenous health. He has served as president of the World Organisation of Family Doctors and as president of the Royal Australian College of General Practitioners. Welcome, Michael. The Centre for Future Health Systems in University of New South Wales is bringing together researchers, policymakers and clinicians. Is this the first centre of its kind in Australia?
I think so, Louise. We have a number of really excellent research centres in health policy in different parts of Australia doing amazing work, working with policymakers and producing high quality research. But what makes our centre different is that we're looking at the future. So we're looking at 10 years or more from now on where we'd like our health systems to be. And then what research do we need to be doing now? What work with policymakers do we need to be doing now? And what advocacy do we need to be doing now in order to get to where we'd like to be 10 years or more from now? And the other thing which makes our centre different is that it is pan-university or interdisciplinary, in that we're bringing together researchers from all the different faculties of the University of New South Wales with a focus on health systems. So we're bringing together people from science and engineering, from law, from business, from the social sciences and the arts, as well as from medicine and health, because so much of the research around where we'd like our health systems to be resides in places other than health and medical faculties.
So where does this centre fit in the broader health and innovation precinct at University of New South Wales?
Yes, so as you probably know, University of New South Wales is about to open or has opened a new building with the hospital next door called the Health Translation Hub. And this is bringing together researchers, it's bringing together clinicians, it's bringing together policymakers, it's bringing together entrepreneurs and industry, all into the same building, all working together to try and solve some of the challenges facing our health systems into the future.
So we've just been talking about buildings, but I suspect it's a much broader collaboration than just all having the same address. How do you see these groups coming together and really, I suppose, batting off each other in terms of the insights they're able to generate?
Yes, so our centre is an international centre, so not everybody will be based in the building in Sydney. We have people based through our partnership with Oxford University in the UK, and we also have colleagues across Australia and around the world, and all working together on different challenges. One of the exciting things being an international centre looking at health systems is that we can look at what's happening in individual countries and see what lessons can we learn about things that facilitate reforms, things which are barriers to change, things which work well in one context, which you may be able to try in a different context, or things which we may want to avoid.
We know historically that research projects are sort of long bodies of work typically. How is this sort of a program and this institution looking to accelerate insight into change in practice?
Yeah, so we'll have a combination of both longer term research activity but also rapid reviews, and particularly reviews of the international literature to find out what we can to then help to inform the policymakers that we're working with, either here in New South Wales at a national level for Australia or around the world in making decisions. So it's a combination of both and again bringing those insights from people who come from different paradigms, who think about things in different ways and who will bring new richness to the results of that research that we're doing.
You've referenced a 10-year horizon. Is that quite specific? Is there research to tell us that we should be aiming for change over that 10-year period?
Yeah, 10 years is quite a good time frame when we're talking about health systems. It takes time to move a health system, to bring about changes. There are lots of factors which need to be brought in, not only the financing of any change which happens, but also bringing along the health providers, bringing along the wider community, sometimes changing the way healthcare is being delivered or the models of care. This all takes time, and so a 10-year time frame is realistic for many of the sorts of reforms that we're looking at. Also, if you look around the world, many of the big reforms in healthcare are 10-year plans. Here's where we are now, here's where we'd like to be 10 years from now, and what is it that we need to be doing sequentially during that time.
If we think about sort of the triangle of research, advocacy and policy, in the sort of current climate, do you feel are they all equal partners at the moment?
I think they're all really important partners and they intersect. So if you're working in an area like health systems, you can't just do research without involving those who are developing the policy and without thinking about how do you then take the findings of the research and use that to advocate for change, to generate public discourse about the way in which we might deliver health services in different ways and what is acceptable to the people who are the ultimate recipients of that care.
I know there are 8 key pillars of research that the centre is undertaking. Can you talk us through those priority areas and maybe bring to life 1 or 2 examples of sort of some of the more novel approaches that you're taking to solving what are long-standing health problems in the main?
Yeah, so you're right. We've focused initially on 8 areas, and the first one is on equity. Equity is probably the greatest global health challenge, making sure that everybody, no matter where you are in the world, has access to high-quality healthcare services. And we know that there's a lot of inequity, including within Australia and within the state. So that's focus number 1. Focus number 2 is looking at primary care, community-based health services and the transformation of primary care. In Australia, we have some major reforms currently underway with My Medicare, with patient enrolment with general practices, a big focus on multidisciplinary team-based models of primary care, but also looking at new technologies coming to primary care. We saw this with telehealth during the COVID-19 pandemic, and integration with other aspects of community-based services. So the integration of general practice with community nursing, with allied healthcare, with dentistry, with pharmacy, but also with aged care and disability care and mental health services and social care services. Third big area is around our hospitals and looking at hospital transformation, not only preparing our hospitals so that we can rapidly incorporate new knowledge as new research happens and new evidence is generated to improve the care being provided to people, but also looking at are there services currently offered through hospitals which would be better being offered out in the community, moving services, people, resources out into the community, which is happening in many countries which are looking at one of the ways to address challenges of healthcare expenditure is to look at, do we need to deliver this service in a hospital, which is a very expensive place, or would it be better moving all that out into a community setting? We're also looking at better integration of hospital care with community care and with
Always
all those
a challenge,
other services.
isn't it? Yes.
Always a challenge, but incredibly important that people get that continuity of care when they leave the hospital after an episode of care. Fourth big area is around digital innovation, and we're obviously seeing many challenges and changes occurring with telehealth, with the rapid adoption of artificial intelligence, with looking at the big data that we now have available through electronic medical records, electronic health records. And our particular focus is on looking at these new innovations and looking at how they improve the safety and quality of the care being provided. So not so much interested in technology for technology's sake, but how it actually improves the care that we're providing. I think one of the big areas of reform that we're particularly excited to explore, particularly with some of our colleagues from science, is the impact that genomics is going to have on healthcare over the coming decade as we move towards better understanding of each individual person's genetic makeup and how that has an impact on their health needs and their health in general, and then on the therapies and opportunities that may raise as well with providing more personalised healthcare, more precision healthcare as well.
Which I imagine raises quite a few sort of ethical dilemmas and questions as well. So I can see the obvious interplay for then bringing in our legal colleagues and the like to start thinking about those frameworks at the same time.
Yes, very, very, very much. So we're very fortunate at UNSW as we have a strong focus on health and justice, and ethics is very much an important part there as well.
I interrupted you there. I think we were heading into health workforce, perhaps.
Yeah. So number 5 is looking at the future health workforce, and particularly, again, projecting out 10 years. And are we training the right people with the right skills and training them in the right places in order to have them prepared to meet future population needs as our health system changes, as genomics becomes a bigger part of healthcare, as new technologies come into healthcare, and as we focus particularly on more multidisciplinary models of team-based care.
Is part of that exploration sort of trying to extrapolate for the system what those roles will even be? It's one thing for us to grow a pipeline or to think about additional places at university, but we sort of have to put ourselves 10, 15, 20 years in the future, look at what roles in health are going to exist that don't exist now, and then work backwards. Is that part of the exploration for your team?
Absolutely. So in part, it's recognising, yes, in 10 years we will still have doctors and nurses and dentists and pharmacists and allied health professionals, but some of the skills that those people are going to need are going to be different 10 years from now than they are now. And this is nothing new. You and I, throughout our careers, we look at what we were trained at medical school, the way that we practice now has moved and shifted very substantially as community expectations have changed, as new technology has become available, as the models of care have changed as well. So
I suspect there will be some brand new roles in health that we haven't yet envisaged, or perhaps an increased reliance on those with really amazing data analytics, just parts of sectors that perhaps are going to make their headway into health in a different way.
Yeah, I think you've touched on one of those important areas, which is around having people who are skilled in the digital health reforms, which are happening now and which are going to continue happening as well. But there may well be other types of healthcare providers, and we're scoping around the world, looking at different health systems and the role of new groups of people who are coming in and working as part of teams. One of the areas that I'm really excited to explore is something that we do very well in our Aboriginal medical services across Australia, is the role of the Aboriginal health worker or Aboriginal health professional working as an absolutely integral part of the team. And we haven't yet at scale picked up that model and utilised it with other priority populations, particularly with people who are maybe new arrivals to Australia, different cohorts of people from different countries, refugee groups, but also for people with different needs from our healthcare system, people with disability, for example. So are there new roles for different types of community health workers, liaison people, navigators, if you like, who can become a really important part of our healthcare system and help us to address this issue of the social determinants of health, which of course is often neglected and is so important when we're looking at outcomes.
I think ageing population you've touched on a little earlier, just specifically I think in that transition piece and, as you say, into the digital health piece, relationships with the general practitioner. I suppose it's well recognised we have an increasingly ageing population. Have you identified any learnings from your journeys overseas and your colleagues and the work that you're doing internationally where you think that's something we really should be thinking about in Australia?
Yes, so this is our number 6 challenge, is the changing population in Australia, which is the increase in the size of the population, and that will have an impact on health systems and health service provision, but also the ageing of our population in Australia. And it's a challenge that we share with many other countries. And of course, as the population ages, you have more people with chronic health concerns, and often people with multiple chronic health concerns, and the challenges that presents both for the individual but also for the health system in providing high quality care to everybody. And so looking at other countries which have been addressing this, one of the big challenges that we have is this intersection of treatment and prevention, and looking at how do we reinforce preventive health care and health promotion and healthy behaviours, so that people, even though they're living longer, are living healthier, longer lives, rather than having many years of disability due to what is often preventable chronic disease and its complications.
So I'm now going to link that back in my mind to what you said earlier about genomics and our, we're all going to have, there will come a time, I feel, like we'll be leaving hospital for the first time having been born with a sort of prescriptive analysis of what our various risk factors are for a variety of chronic diseases right from the start. And with a preventative lens, we could be applying a whole range of targeted, specific, healthy approaches to our life to do exactly what you say, have a longer, healthier life. And so the preventative health piece is so critical, and yet we find even as science gives us these advances, this knowledge, this information, as human beings, we're not always terrific at applying the public health instructions, if you like. This is how to live a great, healthy life, and we still find ourselves sometimes falling down. Is there an element of the work that you're doing looking specifically at those behavioural pieces of how do we change people's health behaviour to really take advantage of this explosion in information that we're all going to have at our fingertips about our personal health journey?
At the health system level, we need to make sure that prevention and health promotion is baked in to the care that we're providing. In my experience, having worked as a general practitioner for most of my career, every encounter with a patient is an opportunity for preventive healthcare, for talking to that person about their immunisation status, about smoking cessation, about diet and exercise, about the sort of preventive interventions that we need to be carrying out for screening for cancer, for screening for cardiovascular risk, and much, much more. Now, understanding your genomics is going to add to that in all sorts of ways that I don't think we can quite predict just yet how that's going to be, but it will allow us to hopefully be a bit more precise in the targeting of interventions for you as an individual. And so for the health systems, what this means is we need to be building into the way that we're practicing medicine and practicing as health professionals, this element of prevention, and strengthening it even more than we do now. And as I mentioned, this is going to be incredibly important as the population ages, because we want people to be as healthy as possible for as long as possible.
So we are lagging a little around investment in that prevention space from a system perspective. I think we're investing about 1.8% of our health budget in prevention. Others are at 5 or 6%. In this advocacy space for this centre, is there not only sort of raising our awareness and looking at system solutions, is there also a piece here around some guidance around where specifically as a system we could be looking perhaps now at disinvesting so that we free up funds to reinvest?
So firstly, it's a challenge looking at these percentages, because the way that they're calculated is different in different countries, and what is counted as funding for prevention in one country may not be counted in another. Here in Australia, where we have very strong primary care and especially a very strong system of general practice, we have prevention built in to general practice.
Yeah.
And as I've said, every encounter with the patient should be an opportunity to be talking about prevention as well as the reason for coming in today. And our computer records provide these prompts to allow us to not have to carry all this in our head, but to be able to work with the individual patient in front of us. So I think looking at building in these measures into our health systems is going to be incredibly important, and part of that through the use of new technology, but part of it also through the training of our health professionals that prevention is important as treatment is important, and also raising awareness with the general public. Here in Australia, we have some very effective preventive health programs. You know, our cancer screening for bowel cancer and breast cancer and cervical cancer, soon to be lung cancer for people at risk, are world class, and you don't find systems like that in many other countries. Our rates of immunisation until COVID-19 were as good as anywhere else in the world, and now around the world we are tackling challenges of vaccine hesitancy, which do need to be addressed because immunisation is so important in preventing serious infectious disease at all ages, but especially in children and in older people. So there's a lot to be done, but it needs to be a core part of the systems that we're developing.
You raise COVID-19. Mm-hmm. You know, when you take a worldview, countries had very different approaches to their management of COVID-19. What is Australia doing now, and what is your centre leading the work in terms of our preparedness for what might come next? And what are the lessons that we can take, and what do we want to put down and sort of start again with in terms of the next pandemic?
Yeah, so this is theme number 7 of the 8.
We got there.
Is around learning the lessons from the COVID-19 pandemic, both here in Australia and around the world, and looking at how we apply those in preparing our health systems for future pandemics and other future challenges. And it's not just being better prepared when it comes to infection prevention and control, although that's incredibly important, as we saw during the COVID-19 pandemic. But COVID-19 also shone a spotlight on a lot of areas of inequality in our health systems, and the populations which were most adversely impacted, both by the infectious agent itself, but also by the public health measures which were implemented to protect the population. So there's a lot to learn. We've recently had released nationally the COVID-19 inquiry, which has a lot of recommendations on how to prepare for future pandemics. And a lot of work is being carried out by each of our states and territories, but also by many professional organisations, many consumer organisations, looking at what are the lessons. We want to make sure that we don't just put that all in the past and forget about what happened, but that we actually utilise the evidence base that grew. And if you look at the medical literature, the amount of publications and research related to COVID-19 and to pandemics has grown dramatically since 2020. Of course, there was nothing on COVID-19 prior to 2020. Sure. But there's a lot to learn and a lot to analyse as we look at, okay, how do we prepare our health systems for these big future challenges? And just while I'm on it, number 8. Number 8 is preparing our health systems for the impact of climate change. This is obviously a growing challenge of importance in Australia and many parts of the world. And again, we're not just focusing on preparing our health systems for climate emergencies, bushfires, floods, cyclones and more, or for the impact of increasing heat stress or vector-borne disease, as we're seeing occurring as well, but also for the impact of possible climate migration as large-scale movement of populations occurs as a result of the consequences of climate change as well. So how well prepared are our health systems for thinking about, okay, if we do start to get some significant movement of populations, will our health systems actually be able to cope with increased numbers of people moving either within the country or from other parts of the country? We've seen a recent agreement with the nation of Tuvalu and Australia, and some people from that island nation who may end up moving to Australia with their own culture about accessing healthcare, their own specific healthcare challenges, the mental health impacts of needing to relocate from your country of birth. Lots of challenges for our health systems there as well.
And I suppose a big piece of that then will also be workforce readiness and workforce strategies in relation to either a sudden change or, as you say, is this somewhat chronic evolution of a response to an international issue. I've heard you speak before about having our workforce leave university or leave their ports of training job ready. Are we there yet? As we mentioned before, the quantum of information is changing all the time. The skills and attributes maybe of the future might be a little different than we see today. How are we partnering well as a system with our education partners to ensure that we're really set up for what these next few years might bring?
Yeah, so this is a big challenge for those people who are responsible for training our future health workforce in our universities and colleges across the country. And are we equipping our graduates with the skills they're going to need to be flexible as changes occur throughout their careers? And I think there are some important principles here as well. Are we training enough health professionals to meet projected future needs? Are we training too many of some types of health professionals for what needs we're going to have or we're projecting we're going to have in the future? It's very imprecise science trying to work out how many doctors we're going to need, how many nurses, because things change over time and people make choices, of course, as to where they're going to live, how many hours they're going to work, where they're going to work in Australia or around the world. I think it's probably to be expected that many of our people who are currently training to become health professionals will probably have a number of careers in the future. They may work for some time in a city, they may work for some time in a rural or remote area, they may work for some time outside of Australia, they may do something completely different to being a healthcare provider. They may get involved in research or teaching or all sorts of other areas as well. So preparing for the future health workforce is really critical. And to do that, you've got to be working in partnership. So you've got to have a partnership between the people who are doing the training, the sites where they're training, the policymakers who are working out what we need to be doing into the future, and with researchers like us trying to work out where we're going to be a decade or more from now.
Yeah, I mean, I suppose one of the big pieces will be, as you say, people moving through different careers, the system to facilitate the mobility of our health professionals in and out of these various career paths, and making that a simpler journey for people, I think will be important. We're hearing more and more from our younger colleagues that work flexibility is incredibly important to them, perhaps in a different way than it has previously. So even that capacity to spend time working abroad in an easier way. But that brings us to sort of a question of equity as well. We are at the moment bringing encouraging a lot of health professionals from other countries to come and join the workforce here in Australia to manage some of our own workforce challenges, which raises some questions as to whether we're depriving other countries of an equally scarce resource. Should we really be prioritising a grow our own process?
Well, absolutely. So I think that countries like Australia, high-income countries, have a moral responsibility to be training enough healthcare professionals in each of the professions to meet our own projected future workforce needs, rather than relying on the outputs of medical and nursing schools in countries which can't afford to lose the doctors and nurses and other health professionals that they're training. So what we should be looking at is, okay, are we producing not only enough, but enough to contribute that we're contributing to other countries' health workforce needs, as well as having people coming from other parts of the world. You won't stop the migration of health professionals from country to country. This is something that young people and older people will do as opportunities arise. But I think we have a responsibility to be training not only enough for our own country, but enough to be contributing to balance those who are coming in here from other parts of the world. And it brings up, the opportunities for young health professionals in Australia to not only spend time working here in Australia, but to look at those opportunities, to spend some time working in other parts of the world, working with Medicine Sans Frontières, Doctors Without Borders, working in another country, whether it's high-income, middle or low-income countries, learning new skills and bringing those skills and insights then back to Australia and enriching our own health system.
So a freer regulatory system that would allow some movement of health professionals would be an interesting global project, perhaps.
Well, we see obviously, it's
always
been the case that people have moved around. It can be more difficult to get registered to practice in some countries than others, and that can be a limitation to the opportunities for people to practice in other parts of the world. But there are also many places where you can go and work, and the registration is not too onerous for people to be able to practice.
The opportunity that is derived from the multidisciplinary team feels like it still has a lot of scope, but we are still trained very much in our professional silos. Do you see a future where our education system is far more integrated right from the start and we're really training as we plan to practice?
Over the last couple of decades, we've seen a rise of interprofessional learning occurring in our universities with a real focus on bringing together students from different health disciplines to work together. A lot of this is done around simulation laboratories and skills learning, and that's very exciting. And I think one of the most important elements of it is teaching each group of health professionals about the work that other health professionals do, and also ensuring that there is respect for the contributions of every member of healthcare teams. Now, when people graduate, if they spend some time working in hospitals, often they are part of really effective, high-functioning, integrated multidisciplinary teams. If you then move out into a private practice setting as a consultant specialist or some primary care settings, you may suddenly find that you're out there on your own, or it's just a doctor and a nurse working together in partnership, and you miss out on some of those other elements of the team, and then you need to be looking at referrals and opportunities to bring other people into the care of your patients. But I think that we're seeing a real push, particularly in primary care, to have more investment in building these multidisciplinary teams with both general practitioners, primary care nurses, but also allied health professionals. And this is a really important part of addressing what we were talking about right at the start, with the rise of chronic non-communicable diseases and the need for many of our patients to have or to benefit from that multidisciplinary approach to their care.
So in that future space where precision medicine, artificial intelligence, and genomics is sort of coming together, what do you think it will be like to be a clinician in that space? And what do you think the health workforce professions' roles and responsibilities might be that are different to what we have today?
So any predictions I can make are highly likely to be wrong.
Just make them. It's
over time, and we've seen that with new technology being adopted very rapidly. Who knew that we could carry a computer around in our pocket with the smartphones which we're using at the moment? And so new technology is going to surprise us in the way it's used in healthcare. I think there are a number of principles that we need to make sure that our future health professionals are thinking about. And it includes the principles of confidentiality and privacy and security of personal information. We don't want to put trust at risk, the trust that people have in their individual healthcare providers and the health systems that they engage with. I think, though, how will this present itself? Will it be through smartphone devices? Will it be through holograms? Will it be through, I don't know.
I have my fingers crossed for holograms myself.
Do you? Yeah, well,
okay.
Those of us who like Star Trek, we've seen the hologram doctor and how that works. But, I think we're just going to be surprised in the way things develop over time. I think we've also got to be very conscious that some of the whiz-bang ideas may actually not be acceptable. to the public. I remember early on with remote consultations, hearing a story about a family who in a hospital with their loved one, and the doctor was wheeled in on a tripod with the box, and you could see the doctor and the family responding really badly to the news that was being imparted in such a informal, technical way. And so, we need to make sure that we don't strip out what is so valuable about the way we deliver healthcare, which is the personal approach, the bedside manner, the importance of being able to hold the hand of someone who's distressed while you talk to them about what's happening to them and happening in their lives.
I'm conscious that there are a lot of major corporate entities seeming to be keen to dip a toe into the health space and the health sector. And you mentioned at the start that some of the partnerships that you're engaged with are partnerships with entrepreneurs and other businesses and corporates. I'm interested in who some of the unusual characters might be that are in this health system space, and what is the place for our corporate cousins, if you like, to have a role in the future of health?
Well, of course, in Australia, we have a balance of both publicly funded health services and private health services as well. And for the individual consumer, the individual patient, often they're moving between these systems. And there is a lot of innovation occurring in both of those systems, but of course there's opportunities in the private sector for entrepreneurship. Now, one of the wonderful things about being based at the University of New South Wales is there's a very strong focus on entrepreneurship, and particularly supporting young people who have wonderful ideas about how to do things in different ways, and maybe have not been indoctrinated too much about the way things have always been, looking at, we could do this differently, and looking at new technology. As I mentioned early on, one of our areas of interest is when we do have an innovation that comes forward, is looking at, is this actually going to improve the safety and quality of the care that we provide, or is it going to create a risk? Because one of the things that we know through the work of Professor Enrico Cuera and others here in New South Wales is that every time we introduce a new innovation into healthcare, we introduce the opportunity for additional risks coming in as well. So we're, not interested in technology for its own sake, but interested in how it improves the quality and safety of care.
Personally, have you identified an innovation that you can't wait to see rolled out across Australia?
Look, I am most excited about what's happening with genomics and the ability, if you were my patient, to have on your patient record your full genetic profile, all the details about your history, all the environmental factors which impact on your health, and then having this very clever artificial intelligence happening in the background, which is going to help you and me to better plan the approach to improving your healthcare, tackling the healthcare challenges that you have. So I'm really excited about what's going to come over the next decade or so with improving personalised healthcare for everybody. Now, it's going to come at a cost, and I think there will be lots of distractions along the way as well before we get to a fully integrated approach to the care of each individual. But I'm really excited working with people on this over time.
So how will the centre share its insights more publicly over the coming years? And where do people that are curious about everything that you've been sharing today, where do they go to learn more about what the centre's work is?
So a very important part of our centre is the advocacy side and the communication of the research that we're doing, what we're discovering, the work that we're doing with policymakers, and encouraging the general public to also consider some of these future challenges to our health systems, and to provide feedback on, I think that would work well, and I don't like that. I don't think that's a great idea or a great direction to be moving in. So we have a wonderful website with details of the research that we have underway. We have a news feed that people can subscribe to. So every time we have a new research paper that's produced, we don't just leave it sitting in a journal. We share that with the rest of the world. We also turn a lot of that research into discussion pieces. We've been working with the conversation with Croaky media and with other groups in getting some of these messages out as well. And then, of course, we have public events and forums which people are very welcome to join in, either in person or, if you're anywhere else in the world than Sydney, remotely as well.
Professor Michael Kidd, thank you so much for joining us today on the Future Health Podcast.
Thanks, Louise. Thank you.
The views and opinions expressed in this episode are those of myself and today's guest, and do not necessarily reflect the position of New South Wales Health. Any content provided is for informational purposes only and should not be interpreted as endorsement or approval by the organisation. New South Wales Health does not endorse any products, services or companies mentioned in this content.